The presence of a quality relationship with the principal caregiver in the first 12 months of a baby's life has been found to be significantly important to a child's long-term psychological development. This relationship is important because it's known to form the basis of a secure attachment for the infant. According to Bowlby's attachment theory, the bond or attachment that develops with the primary caregiver has a biological function to ensure the survival, security and protection of the infant. Bowlby also believes that this bond is the foundation for other relationships that the infant will make in the future. Many studies have found that postnatal depression in women affects parent behaviour and the mother-baby interaction, including possible impairment of communication, less synchrony, reciprocity, and the decrease in emotional involvement and responsiveness. These impaired behaviours in parenting may have a detrimental effect on the development of a secure attachment. A longitudinal survey involving 718 women conducted by Robertson found that women with elevated levels of depression recorded lower attachment scores.
We can see the obvious impact this has on mothers, but how does this affect the partner's experience of becoming a parent? And what are the implications for children in their care? A recent qualitative study showed that partners of women with postnatal depression reported feeling robbed of their experience of becoming a father. They felt as if they were parenting alone in many cases. The level of total responsibility had left them feeling time-starved and stressed, which had impacted their opportunity to develop patient and bonded relationships with their children. Evidence also indicated increased cases of reported hopelessness, poorer overall health outcomes, and even depression for some. These negative impacts on partners' well-being can also impact the baby's development. With these negative impacts, clinicians are encouraged to consider partners when providing care to women. If men and partners also seek treatment during this time, children who experience attachment issues due to the mother's detachment can have improved outcomes also. An engaged parent who's able to support the family can be a protective factor to children. This concurrent care of men could include cognitive behavioural therapy, couples counselling, and more practically, childcare assistance. By caring for the partner's well-being, we're providing the family unit with a caregiver whose stability and connectedness could benefit the whole family.
Society makes it difficult for women to acknowledge that they might be experiencing postnatal depression. Most women are constantly confronted with messages about joy and bliss. These messages don't often mention the challenges that come with motherhood. The media also tends to reinforce the unrealistic expectations of motherhood. For example, it promotes celebrities who appear to be coping very well. Adding to this is the stigma that comes with postnatal depression, where women they don't feel comfortable to talk about their feelings because they've got a fear of being judged. Postnatal depression is often being portrayed in a negative way. Due to this, women will put on brave face to go on to extraordinary lengths to hide how they feel. A woman who isn't coping can feel very alone and can find it hard to come to terms with their feelings.
In reading the research, I was pretty surprised to see that so many mums and some dads are affected by postnatal depression, and there must be many more who remain undiagnosed also due to shame, stigma, or health professionals not recognising the signs or symptoms. So as a midwife in practice, I will remain aware of women with risk factors, women who have a history of mental health problems, women who appear to have a lack of social support or who have poor relationships with their partners, also women who have recently experienced adverse events. And also being mindful not to dismiss any comments like, "I'm terrible at this," or "I'm a failure," or "I'm a bad mother," but speaking more with the women about what thoughts are behind these statements and providing them an opportunity to talk about how they're feeling, and for me to assess if anything is behind this comment. Another thing I will consider when I'm practicing is that unsettled infant behaviour can also contribute to the development of postnatal depression for women, and sustainable settling strategies has been shown to reduce symptoms in these cases. So if I'm caring for a woman with an unsettled baby, I will make time with her and her partner and show them ways to calm and soothe their newborn, to help them to understand their baby's behaviour too.
Ainsworth describes sensitive care being the extent to which the mother responds promptly, consistently and appropriate to their baby, and to hold them carefully with tenderness. I agree with findings made by Ainsworth that sensitive caregiving is the key to successful relationship building. In my support as a midwife, I like to share and promote this way of being to the women in care and to give support and guidance where appropriate. Two activities that I'd like to strongly promote are breast and bottle feeding and baby massage. Breast and bottle feeding are both powerful activities where a mother and baby are brought into physical and emotional closeness. It is important to note that if a woman is unable to breastfeed due to medication or other reasons, that bottle feeding is an activity that is equally fulfilling for mother and baby. Another postnatal activity that has proven results is baby massage. A study conducted by ACE saw that 15-minute massages every day for 38 days increased the maternal attachment inventory results significantly. As a midwife, I believe that spending time with mother in her home or immediately after birth to educate her on how to deliver a 15-minute massage can be a valuable time spent.
Classically, mothers have been at the centre of home and parenting experience. However, with recent changes to family dynamic, the father's role is becoming far more important in the development of his children. It's therefore important as clinicians to include them in the maternal care as much as would be of benefit to the mother. My role as a midwife is one that's primarily women-centred, but to be truly women-centred, we need to include her support team in our care. I know some men can feel excluded during labour, and for some people a negative birth experience can cause great angst and even mental illness. I would like to bring to my practice a feeling of inclusion and connectedness leading up to and during the birth experience for both the mother and her partner. There are many opportunities for the partner to feel useful, valued and connected during this intense, exciting and sometimes scary time. As a midwife, I'd like to equip them to be a positive support to their partner and set the scene for a strong, connected partnership as parents into the future.
As Fontaine says, knowledge empowers us to understand cultural differences, and sensitivity enables us to respect and honor differences. If these are combined together, we as midwives are able to provide a cultural sensitive care to women and their family. As a midwife, I need to develop an understanding of who I am in order to understand women and their families, to help them achieve their full potential. When I identify my own attitude, values and prejudices, it helps me to understand my feelings about people who are different. I need to know myself first to become a sensitive midwife. So how, as a midwife, do I do that? Communicating is important when caring for women for their best background. I need to present myself in a confident way without acting superior to the women and their family. Respecting their culture, to ask for clarification when I don't understand the woman's behavior and not make assumptions about their behavior.
The continuum of support for women from pregnancy to the postnatal period is important to maintain positive maternal mental health. Motherhood can be a big transition to the woman's life, and they are more likely to be at risk of depression, chronic stress and anxiety in their first year postpartum. Being thorough and sensitive to the woman's emotions are some of the skills that I will use to minimize the risk of postnatal depression. Understandably, mothers may feel a lack of ongoing support once discharged from the hospitals, with the only support being domiciliary care, which is generally only 2 visits. The lack of ongoing support may be one of the factors that can trigger postnatal depression. Hence, as a midwife, I would need to be mindful and aware of how she is coping while in hospital in order to provide a comprehensive, individualised care plan. As part of my practice, I want mothers to recognise their emotions. To do so, I would provide education on baby blues and postnatal depression. For example, the signs and symptoms she should look out for and who she should see when these occur.